right, perfect. Hi, my name is Hillary Genovese. I am a board certified behavior analyst, and I am the clinical director in our Berkeley Heights, New Jersey location. Welcome to an introduction to ABA. Just to let everybody know, everyone is on mute. If you'd like to ask a question, please unmute yourself or type in the chat. Questions are welcome at any time. We want this presentation to be as interactive as possible. So please ask questions throughout. A little bit about Bierman Autism Centers to start. It's a place where young kids engage in play to learn foundational skills they can build upon, such as self-advocacy skills, like saying no or telling us they're all done, or letting us know that they need a break, and other communication skills. We recognize that every kid's success is unique, and our one-on-one approach allows us to drive progress using measurable outcomes while each child is advancing on our own terms. So we really look at what's important to our child's progress, what's developmentally appropriate, and what's important for their families. Our team is dedicated to making learning welcoming and fun by blurring the line between learning and play. So kids at our centers enjoy taking on new challenges and becoming motivated as they learn new skills. Our approach ensures that kids become confident and empowered lifelong learners. So it's really important to us that when our clients show up at the door in the morning, they really want to be there. So really building a relationship with them, getting to know their likes and their dislikes, and really using that throughout their therapy day to encourage learning. And again, blur those lines is something that's really significant and really impactful in their progress. The Bierman Circle of Care and Support includes the entire family and not just the child. We empower parents through training and collaboration. Parent training is a really important piece of our model, as well as supporting things like this webinar.
Hi, Hillary. We have a great question in the chat. Is Bierman Autism Center like a school?
Yeah, that's a great question. So we talk a lot about Bierman being kind of similar to like a daycare or a preschool setting, in that there's a lot of play. There are things like circle time and gross motor time, physical activities, art projects, but we are insurance funded. So all of our children have treatment plans that we submit to insurance, and we have very individualized goals. So unlike the school system, where school districts are kind of confined by state standards and things like that, we are we practice in line with insurance requirements, but everything we do is really individualized based on children's specific needs. And then they get that social piece too. So again, like being in a daycare, being in a preschool setting, they're in classrooms or they're in groups, and they're able to work on social interactions and play, and really teaching them kind of anything that that might be important to their learning.
We had another great question come in about if we don't and have insurance, will that cover it? Or and if we have any kind of out of pocket. So I think probably Hillary, if you want to take that, but probably the best thing is to talk to our insurance team, because they have all those answers, right?
Yeah, so I I speak to insurance to get our treatment plans authorized and things like that. But the nitty-gritty about insurance is not my area of expertise. We definitely would encourage you to reach out to our billing team and reach out on our website if you want to move forward with interest in like a particular location. Typically, before we do an intake, our insurance team will review your insurance benefits or review with you potential out-of-pocket costs, and be able to provide that information to you before moving forward with like an intake assessment and a tour and things like that.
Thank you.
Yeah. So the Bierman pillars, we really value letting kids be kids. So again, accepting each child for who they are. Learning through play is something that's so important to us. Again, really blurring the line between learning and play. We want our kids to be having fun. We want them to be engaged. We want them to be motivated. We don't use any sort of forced compliance. We really look at what are our kids interested in, and how can we use those interests to teach them a variety of things. Empowerment is key. So again, using everyday activities to teach kids foundational skills such as self-advocacy and communication, really teaching to independence and self-advocacy from the time our kids are 18 months old. So maybe that looks like pushing items away or shaking their head no, but teaching them from very early on that they can let us know if they don't like something or something is bothering them, or they don't want to participate. And engagement with families, again, is really crucial to our model. Parent training, ensuring that parents are really involved in everything that their child is learning. And so we can ensure that there's consistency across settings within the center and within the home setting. So building that connection and working toward those shared goals. And then a commitment to progress. So we really, we take data all day, every day on everything we're teaching. We write progress reports. We do updated treatment plans. We really look at what kind of progress are our kids making every day toward their larger goals. So our agenda for today, we are going to discuss an overview of what applied behavior analysis is. We're going to talk about how and why behavior happens. And we're going to describe a day in the life of Bierman for our kids. So first, what is ABA? ABA stands for Applied Behavior Analysis. This is a science dedicated to understanding how and why humans behave. And behavior is anything that a living organism does. So a living organism ranging from you to me, to your children, your boss, your cat or dog. So as behavior analysts, we focus on defining and teaching behavior that will make socially significant changes for our clients and their families. And that socially significant piece is really the important component of what makes what we're doing applied behavior analysis. So the only way to do that is to learn how and why someone behaves the way they do and work with the environment to improve behavior in socially significant ways. And what we mean by socially significant, we mean teaching skills that will increase the overall life experience for someone. So something that might be an example of this would be teaching our kids to follow safety instructions in the community, things like responding to stop or responding to come here, or responding to an instruction to wait in a location or wait online. If we teach those skills, that might increase our kids' ability to participate in community settings and decrease maybe some anxiety or stress for families and friends and people who are in the community with our kids. It might be teaching kids how to ask for things that they want and need to have better relationships with those around them. So being able to communicate that they're hungry, they're tired, they're thirsty, anything that they might need in their environment. And then as behavior analysts, we focus on those socially significant behaviors for our kids. So what ABA is not, it's not counseling services. It's not only used with pets. So ABA, again, can be used across a variety of populations. You can use it with your husband, you can use it with your child, you can use it with your boss, you can use it with your pet. You can use it with individuals diagnosed with other mental health diagnoses like schizophrenia. It's not only used with individuals with autism, and it's not focused on changing the thoughts or interests of people. It's not bribery. It's not looking to fit someone to a standard norm. It's not promoting robotic behavior. So there are narratives of ABA on the internet, and they exist for a reason. Really, Bierman does what I call progressive ABA. So really looking at, again, the interests of our kids, looking at play-based instruction, really moving away from that narrative of sitting at a table and maybe presenting hundreds and hundreds of picture cards for 30 minutes before moving on to something else. And where do you see ABA? So you see ABA in clinic settings or centers, in homes, in schools, in the community, basically anywhere. And you can see it used with a variety of populations. So early intervention with children ages 18 months to 3 years old, children through school aged years 4 to 18, collegiate athletes might use it to improve performance with a certain task. Adults in large corporations, it could be used to change staff behavior, like increasing productivity. So how does EBA work? What we really look at initially are the functions of behavior. And we provide typically a lot of parent training and support, especially when our clients first start with us, looking at the functions of behavior. So there are 4 functions: attention, access to tangibles, escape, and automatic. So again, this is really looking at why a behavior is occurring. And that's going to give us a ton of information about how we can put in skill acquisition programs, and how we can proactively teach in the environment, and how we can also be reactive when we see occurrences of behavior in order to promote more pro-social behavior and maybe decrease interfering behavior. So attention means that a person is engaging in a behavior to receive attention from someone. This could be attention from a parent, from a teacher, from a friend, from a sibling, from a boss. In our own lives, we might see someone likes to work out at the gym more if they have a workout buddy, because of the attention they receive at the gym and the support and that social piece that occurs when you're working out together. Access to tangibles means that they want to access something that they can touch, feel, see, hear, smell. So most frequently we think of it, or we see it in terms of maybe a preferred toy or an activity, or maybe a favorite food item. So maybe access to cookies, or access to staying at the park just a little bit longer, or access to stopping at McDonald's when you drive by. And why do most people go to work? Hopefully for other reasons than just money, but we do go to work to make money. Why do we make money? So that we can access tangible things, so we can purchase things like food and pay our bills and get gas for our car and things like that. Escape looks at a person wanting to get out of something that they don't want to do. So maybe they're presented with an instruction to complete a task that they really don't prefer participating in. It might be something like it's time to go to school and school is not a preferred place, or maybe they hate taking a bath and you say it's time to take a bath, and you might see some interfering behaviors. Or it might be doing homework, going to the doctor, really anything that we don't prefer doing fits within this escape function. And then automatic, which is the trickiest function. It doesn't necessarily have something to do with the social environment, so it's not what we call socially mediated. And a lot of times people don't realize they're doing it. So you might see somebody biting their nails, or playing with their hair, maybe wiggling their leg, spinning around in circles, flapping their hands, repeatedly spinning wheels on a car. So something about that just kind of feels good. Something about it is self-soothing. And I always, like to mention that we all, or most of us, engage in some sort of automatically maintained behaviors. So again, things like twirling your hair, shaking your leg, biting your nails, anything that we might do that provides us some sort of anxiety relief, or just something about it just feels really good. Why are the functions of behavior important to us? Because they tell us what we need to teach or what skills someone may be missing. So again, we really look at the functions to inform what we're teaching and how we're teaching it. We teach new skills, or as we like to call it, skill acquisition. So we look at behaviors we want to decrease, which would be skill acquisition, and behaviors we want to decrease. So again, behaviors targeted for reduction. So some examples of this might be Sammy screams when his mom comes into the room. Every time Sammy screams, mom might give him hugs or kisses or cuddles or some sort of vocal attention, which is totally fine. Nothing wrong with giving Sammy lots of attention and love. But maybe we could teach Sammy instead that when his mom comes in the room, he could say, "Hey, mommy, play with me," or "Come here," or "Hang out with me." Or maybe he could tap her on the shoulder to get her attention, or engage in a more appropriate, less interfering behavior than screaming to indicate that, hey, I need some attention right now, hang out with me. So the function there would be attention. Another example might be during dinner time, Lucy takes her plate of food, she throws it on the floor, all her food goes everywhere. It looks like Lucy might not be interested in what she has for dinner. And maybe she knows she has a history of when that happens, mom or dad or somebody will pick the food up, throw it in the garbage, and then she doesn't have to eat. So she gets to escape eating those Brussels sprouts that she really didn't want to eat. What if we could teach Lucy instead that we can put Brussels sprouts in front of her and she could say no, she could exchange a picture that says no on it, she can shake her head, she can push the plate away without throwing it on the floor as a way to indicate, I really don't like Brussels sprouts and I would prefer if you gave me a different vegetable or a different food item. So we aren't trying to change Lucy's likes and her dislikes. We're not trying to change her preferences. We might not be trying to require her to eat the Brussels sprouts. We just want to teach her that there are alternate, less messy ways that she can communicate that she doesn't want to consume that food item. But you might be thinking, well, what if that's the food item and that's what she has for dinner and we don't have any other options? Which is fine, stay strong. We would be able to talk about ways that we could positively create that environment as well. But we look at these as all teachable moments. So what else do we teach? We teach lots of behaviors for increase. We really focus on speech and communication as our primary goal, especially when we start with new kids and especially with early learners, because with increases in speech and communication, we often naturally see increases in play behavior and social behavior, but we can teach anything that's really, again, that word socially significant for you. So we can teach toilet training, independence. So maybe things like putting on shoes, using utensils, drinking out of an open cup, anything that's important to you and your family and that's developmentally appropriate are all within our scope of teaching. We also look at behaviors to decrease. As we dive into this slide, I would like to preface that when we talk about decreasing behavior, we only look to decrease behavior when it's determined to be socially significant. So maybe when it impacts someone's social skills or access to other things like access to participating in the community more consistently. It's not an attempt to change an individual or take away things that they enjoy. It's just an attempt to increase their access to opportunities within the community. So undesirable behaviors may be such as screaming, crying, kicking, biting, hitting heads. No matter which way you look at it, challenging behaviors are a way that your child has learned to communicate. In an effort to reduce some of these behaviors to levels that would occur in a child their age. So, things like 3-year-olds crying, 3-year-olds cry, 3-year-olds dropping to the floor. We always work to teach a communication skill as a replacement. So again, going back to those functions of behaviors, figuring out the why so that we can teach communication skills that are more appropriate and still get them things that they want and they need, but in a way that's a little bit more meaningful. Repetitive behaviors and stereotypy. So things like repetitively doing the same task over and over. Maybe it might look like lining up crayons, lining up cars, spinning around in circles, something that your child might enjoy doing for a long duration. And again, something about it might just feel really good to them. So at Bierman, we don't look to get rid of these behaviors completely, especially when it's something that a child enjoys. Maybe if they're lining up cars or lining up crayons, we want to teach to other play skills. We want to show them that, you can also color with crayons. You can also put cars on this cool car ramp. But we wouldn't look to necessarily completely eliminate that behavior. We just work on expanding preferences to more things that they enjoy and making sure that it's not interfering with everyday routines and activities. So, perhaps if you do interrupt lining up cars and maybe we see some more of those significant interfering behaviors like head hitting, maybe we might want to work on a tolerating skill where the child might tolerate playing with crayons in a little bit of a different way. And then we can also look to decrease the amount of time it takes to complete certain tasks. So maybe your child has learn to shower independently, but it's taking 45 minutes to shower, and that's not really conducive to your morning or nighttime routine. So that might be something that we can work with you on, teaching your child to take a shower and still shower effectively, but taking less than 45 minutes. Next, we're going to talk about the power of reinforcement. With a conversation about reinforcement also comes a conversation about punishment, which can be a little bit of a word that has negative connotations in like everyday life. So we'll talk a little bit more about what punishment means from like an operational definition standpoint versus how we kind of use it more colloquially. So reinforcement is a change in the environment that immediately follows a behavior that leads to that behavior continuing to occur in the future. So an example might be a child says, "Pick me up," with outstretched arms during a walk outside. Almost every time a child asks, a caregiver smiles and picks them up for the remainder of the walk. The child continues to ask towards the end of every walk because they know that in the past, when they say "pick me up," when they reach their arms out, those caregivers or that caregiver is probably going to pick them up. A non-example would be a child says, "Pick me up," to their caregiver with outstretched arms during a walk outside. Almost every time they ask, the caregiver tells them, "We're almost home, you can do it," and doesn't pick them up. The child stops asking for a while. So the caregiver did not reinforce that behavior. They didn't give them access to being picked up. And now the child learned that when I ask to be picked up, the answer is probably going to be no. So I'm not going to ask anymore, or I'm going to ask much less consistently. And then punishment. So punishment is a change in the environment immediately following a behavior that leads to the behavior decreasing in the future. So punishment in ABA terminology is not bad. Punishment, does not mean things like timeout or yelling or any of those kind of traditional things we think of when we hear the word punishment. It simply means a decrease in the future frequency of a behavior. So for example, if you maybe submitted a project to your boss and you got some corrective feedback, and in the future, you follow that corrective feedback and you didn't make those same errors, that is due to a punishment procedure. So you are trying to avoid in the future getting that same corrective feedback. So you change your behavior. So again, the word punishment in everyday language has a bad reputation, but it's more of just that decrease in behavior. Maybe you called out of work a few too many times and you received a written warning for your attendance. It's likely that your calling out of work behavior is going to decrease because that was a punishment procedure that was implemented. So again, we come into contact with punishment all the time in our everyday lives. So again, reinforcer is something that when presented after the behavior increases the future frequency of that behavior. So that future frequency piece is really important. We don't know if it's a reinforcer until we determine it increases the future frequency of the behavior. And similarly with a punisher, something that when presented after the behavior, it decreases the future frequency of that behavior. So we're going to practice. I'm going to model the first one, and then I'm going to open it up in the chat for some participation. So the first example, Ethan begins wearing underwear during the day. He goes to the bathroom in his pants, leaving them very wet. After 2 accidents, he stops going to the bathroom in his pants. Is this an example of reinforcement or punishment? So this would be an example of punishment. And what functions as the punisher here? Wet pants functions as the punisher. So the next example, I am going to encourage some participation, but I'm happy to help if needed. So for the next example, Nellie loves getting ice cream. As the ice cream truck passes, she says, "Daddy, can we please get some ice cream?" Dad takes her over for a small cone with rainbow sprinkles. Every time she sees an ice cream truck, she politely asks for ice cream, and he almost always lets her get it. Is this an example of reinforcement or punishment? Reinforcement, perfect. And then what functions as the reinforcer here? Access to something. Yeah, he always gets the ice cream, so perfect. Yeah, so she asks for the ice cream and she gets access to it after she asks almost every time. So the ice cream is functioning as a reinforcer. So in the future, when she sees an ice cream truck and she's with dad, and potentially with other people, she is probably going to ask for some ice cream. Perfect. All right, we have another example. Jack loves to jump on the couch. Mom says, stop jumping on the couch. Jack stops jumping on the couch and chooses the mini trampoline instead. This one's a little tricky. Is this an example of reinforcement or punishment? Punishment, perfect. So this is an example of punishment. What functions as the punisher in this example? So hearing the word no in this example, oh, somebody answered. Yeah, he stops. So he hears the word no, and then he stops engaging in the behavior. So no functions as a punisher because it decreases the likelihood that in the future, Jack is going to jump on the couch. And the function of this is still access to tangibles, even though he doesn't get access to jumping on the couch. That's still the function here. All right, we have another one. At bedtime, Grace's mom tells her that it's time for bed. Grace screams and cries no and runs to her toys and begins to play. Mom lets her play for another 20 minutes and then tries again later. Almost every night, Grace begins to cry when it's time for bed. Would this be an example of reinforcement or punishment? Perfect. Yeah, so when Grace screams and cries, oh no, when Grace screams and cries, Grace gets access to continuing playing. So mom is reinforcing the screaming and crying behavior by giving her continued access. So this would be an example of a time where we might want to teach two other communication skills. So if mom anticipates that when she goes to tell Grace it's time for bed, maybe she teaches Grace that she can say, I need more time, or not yet, or I want to play, or 5 more minutes, or communicate that she's not ready yet. And then once we teach that communication skill, then we might start looking at tolerating the not right now piece. So maybe sometimes you say you want more time and you get more time. And then maybe sometimes, unfortunately, it's really late and you can't have more time. And we still would like to see that tolerating skill without screaming and crying accompanied with it. So all of these are teachable moments. The needs of your kids are always changing, and so are their goals. This allows us to keep up with them and what's going on to help them most in their daily activities. So we are constantly looking at skill acquisition, looking at the things they're learning, looking at what's significant for you, looking at what's significant for their teaching and learning, and really capturing these teachable moments. So now we're going to chat a little bit about a day in the life at Bierman. So the team at Bierman includes a behavior analyst, so a BA or a BCBA. They would collaborate with you and any sort of professionals like speech or occupational therapists on developing socially significant goals for a treatment plan. So again, looking at what goals are important to you, what goals are developmentally appropriate, and including them in what we call a treatment plan that we submit to insurance. The BCBA conducts assessments and oversees their everyday learning. They overlap with registered behavior technicians to provide training and support, making sure that your kids are meeting their learning goals, supporting the rest of the team members, and they're your main point of contact. So they also conduct parent trainings and would be accessible via phone and email and drop off and pick up to really communicate any important information about your kids or any important information about the things that they're learning. Next, we have a behavior technician. They work with your child one-to-one and implement the teaching procedures as designed by the behavior analyst. They would assist with pickup and drop off each day. So they're a familiar face that you'll see in the morning and in the afternoon. They provide the stimulating and fun learning environment. They support everyday routines such as meal times and toileting, and they are working directly with your child all day. And then at Bierman, we have a position called a training and program specialist, which is a 3-tier model, and it's kind of unique to our program. It's the middle person between the BA and the BT. So they support the training of the behavior technicians. All our training and program specialists are often doing their coursework to become BCBAs, but they haven't finished their classes yet, or they haven't finished their supervision hours. Or they haven't just finished the requirements that make them eligible to be able to sit for the BCBA exam. I skipped ahead, sorry. They support BTs in access to toys or materials during the therapy day. They might take something that we call integrity data. So again, really looking at making sure that everything we're teaching and everything we're doing is really consistent for our kids. And they help the BCBA out. I call them the BCBA's right-hand man. And they support the coverage of one-to-one therapy when a team member takes a lunch or might be out for the day. So they're in therapy as needed, and they really are kind of the liaison between BCBAs and BTs. And then the clinical director, so I'm a clinical director in our Berkeley Heights Center. We support all of the team members at the center. We oversee clinical decisions in the program for every child. So we participate in parent training. We help facilitate further training and learning opportunities for all of our team members, and really just provide support for all of our kids' clinical needs. And then a practice manager who oversees the day-to-day operations at the center. So they manage scheduling for team members and families. They navigate maintenance requests, building upkeep, fun activities, any sort of paperwork. They're really your go-to person for all things operations. What drop-off looks like. So you would bring your child into the center. You might meet with their morning behavior technician and bring any news. So anything significant that you might want to note. Maybe they didn't sleep quite as well as they usually do. Maybe they didn't eat their breakfast. So you would like them to eat breakfast at the center. Maybe they had a great night's sleep and they might not need a nap that day. Any sort of important information. Maybe they woke up and you just feel like they kind of woke up on the wrong side of the bed. So maybe we might want to ease into things. You'll say your goodbyes, hand off their backpack, their lunch, anything else they might need for the day. From here, to start the day, the behavior technician helps your child with any morning routines. So typically that might look like bringing their lunchbox or their stuff to the refrigerator, going to their cubby to leave their jacket and their backpack, unpacking their book bag, maybe going to the bathroom, maybe getting their breakfast ready. And then the BT helps your child to find their first activity for the day to really start capturing a fun play environment for them. So maybe they want to start their day in the gym. Maybe they want to start in their learning area where they have all of their favorite activities on their toy shelf. We really, again, follow their lead, see where that might take them, and then go from there. sessions throughout the day. So typically our kids have about 3 to 4 sessions with a behavior technician lasting about 2 hours each. Typically our kids have about 3 behavior technicians that they work with pretty consistently. That might be like a morning technician, so maybe 8:30 to 11:30, maybe a midday behavior technician 11:30 to 1:30, and then an afternoon behavior technician from 11:30 to 4:30. So we try to keep that as consistent as possible, so that our kids can really get to know our staff, and that our staff can get to really know our kids, their likes and their dislikes, and we're able to establish a really strong relationship with them. But it is also important that there is some variety. So we want to make sure that our kids are generalizing skills, so they're able to demonstrate skills across a variety of different adults. So maybe a new behavior technician, or a new BCBA, or just somebody that they're a little bit less familiar working with. Intermixed with play, the behavior technician contrives learning opportunities or teachable moments to assist in teaching skills from the treatment plan. The behavior technician capitalizes on learning opportunities with toys and activities that your child might show a particular interest in. So maybe your child really loves to play with blocks. We can use those blocks to teach them to label colors, or to teach them to build novel play structures. Maybe they typically build a house with blocks every time they play with blocks. So that might be an opportunity to work on building towers or building a person with blocks. And we might be able to work on counting with the blocks. We really can capture a variety of teaching opportunities with various different materials. And with that being said, we want to encourage and we want to capitalize on our kids' interests, but we also want to expose and expand their interest to new activities. So we want to try a lot of things out. We want to maybe take them to a new play area. Maybe we got a new toy in the center and we want to show them the new toy and see if they like it. We really want to use these opportunities to expand their interests. So teachable moments, what is most often taught, again, looking at communication skills, play skills, social skills, independence goals, transition readiness goals. So maybe things like attending to a teacher during circle time, or raising their hand, or following a morning routine independently. So anything that'll be really important and helpful in a transition to maybe a setting where they're not one-to-one. Maybe there's 3 teachers and 10 kids in the classroom. How can we prep our kids to transition to less restrictive settings? And again, within those teachable moments, different teaching strategies might be used. So every child has different goals, needs, and learning styles. Once we get to know our kids, the behavior analyst capitalizes on these individualized needs to set up a learning environment that works best for them. And we really encourage families to come work with the behavior analyst, to come and observe and see your child in action. So those parent trainings are so important. We do them via Zoom, we do them within the center, we can do them in home, really wherever is most significant for you. But it's wonderful if we have the opportunity to provide parent training in a variety of settings so that we can work on a variety of skills, and really, again, encouraging parent participation, parents coming to observe what's happening in the center, what a teaching session looks like, what their therapy day looks like, and then really prioritizing any goals that we're working on that are really significant in the home. So for example, if we're working on teaching a child to point, to request things that they want, we really want to make sure that that's also happening at home, and that you feel comfortable using what we call prompt procedures, or using teaching procedures and reinforcement strategies, so that there are more practice opportunities throughout the day and on the weekends and at night, and that the expectations are really clear and consistent for our kids. So different teaching strategies might be used. And again, something really, teaching strategies are really individualized, and something that as we start to get to know our kids, as we start to work with them, after a couple weeks or a couple days that they're in the center, we really start to get an idea of what kind of teaching strategies might work best for them. But that's also always changing. So we're always reevaluating the way that we're teaching, the prompt procedures we're using. So naturalistic teaching, to the average eye, it looks the most like play. This is our go-to in teaching new skills. And again, really a place that we start. So you might come to our center and you might see kids playing on the floor, playing with blocks, playing with doll houses, playing with whatever's interesting to them. And it might look a lot like a daycare or a preschool setting. And we're finding opportunities within that play with a doll house to maybe work on imitation skills or expanding their requesting skills, expanding their labeling skills. Again, working on whatever is within their treatment plan and is significant to them. Naturalistic teaching gives us the opportunity to make sure that learning is fun, natural, and engaging. You might also see some more structured, discrete trial training, which is used to teach skills in a way that gives kids more opportunities to practice harder skills. So there might be a little bit more repetition. It might look a little bit more structured. It involves a very clear beginning, middle, and end, which assists with predictability and consistency. When possible, we embed our DTT into play using play materials and activities. And then fluency-based instruction, which is something that's kind of unique to Bierman and not something that all ABA providers used. It's a teaching arrangement used to teach skills that might be more difficult to learn. It involves clear expectations and repeated practice, and it really focuses on the accuracy and the speed of the behavior, often leading to skills that are learned faster, retained longer, and can generalize into everyday activities. So really looking at, how quickly are you able to label these objects? How quickly are you able to pick things up using a pincher grip? Again, really looking at that as an indicator of whether or not the skills will generalize and maintain. Toileting at Bierman, so whether your child is potty trained or not, there are regular checks and changing. You can always collaborate with the behavior analyst if there's anything specifically in terms of frequency or routine or just any specifications about toilet training or diaper changes. And mealtime, similarly, we really follow the parents' lead and really want to keep our kids' routines consistent with what's happening on the weekends. So most of our kids have a morning snack and an afternoon snack and a lunchtime. But if that's not what works for your child, then that's not what we'll do. We have meal times at, again, any time that is important to you. So if your child eats lunch at 11, great. If your child eats lunch at 2:30, that also works for us. Whatever works for you, we are able to accommodate in order to ensure that our kids are ready and available for learning and feeling fed and ready to have a productive day. So collaboration with the behavior analyst is important here, just like with toileting. When we start the process of intakes and parent orientations and really start that communication, these are all questions that we would ask you, and so that we can keep those routines consistent. Similarly, naps, depending on the current routines and the age of your child, naps do occur. Again, just like eating, we want our kids to be available for learning. So if that means that they need a 2-hour nap, then they will take a 2-hour nap at the center and then be ready to go for the afternoon. Each child that naps has their own cot. Typically, parents send in anything needed for naps. So maybe blankets, pillows, stuffed animals. Maybe they need some sort of specific song to fall asleep. Maybe pats on the back are helpful. Anything that's helpful for them to fall asleep, again, we are able to accommodate. And then we send those sheets home or those items home weekly so that you can wash them and send new ones in the next week. And then pick up. So at the end of the day, the RBT that supports your child in getting ready to leave, including gathering anything that needs to go home. So lunch boxes, water bottles, backpacks, jackets. You'll meet with the RBT and your child to say hellos and goodbyes. The RBT will review overall how the day went and provide you with a parent note. So we send parent notes home every day that include information such as supplies needed, what they ate, how frequently their diaper changed, or how frequently they went to the bathroom, if they napped, anything that they did really well with, anything that might have been a little bit more challenging for them, if they saw the speech therapist, if they saw the occupational therapist, anything that might have happened in their day, that might be significant to note, and that might be helpful for you to be able to communicate with them about their day. This is also a good time to flag down the BCBA if you have any questions or concerns. So typically a clinical team member, so somebody like the BCBA, the practice manager, the clinical director, or a TPS will be responsible for pickup rather. So they would be able to get the BCBA if you had any questions or concerns that the behavior technician maybe wasn't able to answer. At pickup, team members do their best to be available at pickup and drop off. So again, if you need someone and you don't see them, don't hesitate to ask. All right, that is everything. Does anybody have any final questions? So we do have a question. Somebody asked, what ages do you serve? We serve children from diagnosis. So from as early as, 15, 16 months, potentially earlier if they get a diagnosis earlier, up until around the ages of 11, at which point we would probably work with caregivers to determine a more long-term placement. So most of our kids are about that like 3 to 5 early intervention range, but again, from diagnosis until about the age of 11. Somebody asked, you do half days so that my child can attend kindergarten. So this would be specific to individual centers. We do have some kids in half day programs. We would do an intake session. We would do an intake where we would kind of determine our clinical recommendation. So our clinical recommendation might be for 40 hours a week of intensive services, or our clinical recommendation might be that they remained in kindergarten and that they come to Bierman for half-day services. It's really client specific. A lot of our kids are, or most of our kids are there for full days, again, because of a clinical need for those intensive services. So the earlier the intervention and the more intensive the services, showed better outcomes for closing the gap between our kids and typically developing peers, and really being able to transition them to a less restrictive setting sooner rather than later. Somebody asked, how do you ensure that a child will graduate Bierman and matriculate into the grade as their same age peers? That's a great question. So we really look at a lot of different metrics when we are planning a graduation. We look at things like assessment scores. We have transition readiness documents or transition readiness checklists that we start to look at typically with families like as soon as a couple months into services, really having that conversation with caregivers about where do you see your child in their next setting. My catchphrase is that we love our kids, but we don't want them here forever. On a personal level, I do. But in thinking about transitioning to a setting where they're not receiving 40 hours of one-to-one services is our goal. So we have a lot of graduation data, looking at how many kids that we've graduated, looking at their assessment scores, looking at how many program modifications we've made in terms of making changes to things, making them harder, increasing the amount of things that we're teaching them. So we really look again and collaborate heavily with the parents to determine what's that next fit going to be, and how are we starting to teach the skills almost immediately, or the prerequisite skills almost immediately, to be able to transition them. Somebody asked, is an evening session available for kids going to pre-K? So our centers are open from 8:30 to 4:30. See if I missed any. I think those are all the questions.
It looks like it, Hillary.
All right, any final questions? Do we do home ABA? No, so we are only a center-based provider. We are a center-based provider that I might be actually a center-specific location. We are predominantly a center-based provider. That there might be some differences depending on the location. Can a link to the recorded meeting be sent to the attendees?
Yes, we will have it sent to you tomorrow.
Oh, we have a couple more pop up. Sorry if I click and it goes to another view. Our kids grouped by age. So our kids are grouped in the Berkeley Heights location, grouped by age. Again, I think there might be some differences in different centers just based on layout. In Berkeley Heights, our kids are grouped by age and based on also like the types of activities and the types of learning goals that they have. So we want to make sure that our kids have access to like age appropriate peers. So we don't typically have, a 10-year-old in the same classroom as a 2-year-old. We also want to make sure that we have developmentally appropriate activities in each room. So again, our oldest classroom in Berkeley Heights is 7 to 11-year-olds, and the activities in that room look very different from our room with our babies who are about 16 months to 2 years old. So there are a lot more cause and effect toys in that room, puzzles, books, just a lot more toys in general than again our older classroom. But that might be a little bit different depending on the center. How soon prior to a Bierman student's graduation will you present a transition plan to a family? So in our initial treatment plan that we write after we do an intake, we include a transition plan. That transition plan will be typically modified as we start to get to know your child a little bit better, and as we start to get to know what your goal is in terms of a next placement. And we start to review those transition documents and those transition checklists typically as soon as like a couple months into therapy, but probably sooner, if that was something that was important. We really individualize everything we're doing. Some families don't want to talk about a transition a month after they've started, and some families want to start talking about a transition, immediately. So everything we're doing is planning for that transition, but how much you're reviewing those specific checklists will really be dependent on individual families and their preferences. All right, those are all the questions that I am seeing.